Hello, my name is Sam Gluck. I'm an ICU registrar, and I'm just finishing my PhD using smartphones to measure patient outcomes. And I want to talk to you about a project that we're about to commence in renal patients. So, how do we classically measure outcomes? Well, we use mortality, length of stay, and readmission to hospital. But if you don't die and you're not readmitted to hospital, then these outcomes are pretty well meaningless to you as a patient. So we need to be using more patient-centred outcomes. So how do we measure patient-centred outcomes? Well, we can use questionnaires or in-clinic assessments. The questionnaires are subjective and often lack the construct validity needed for the population in which they are being used, and so they miss certain domains where our patients are struggling. The in-clinic assessments will often only assess one element of that patient's recovery, and both only provide a point-in-time assessment. So can smartphones do better? Well, we can use GPS data to measure how much our patients get out and about. We can measure how much time they spend at home, and we can measure how far they get when they leave the house. We can use step data to work out how active, or indeed how inactive, our patients are. And we can use the number of calls that patients make or the number of text messages patients send to get a measure of how socially active they are. So what, I hear you ask? Well, patients care about how active they are and how much they get out and about, and so patients would like this kind of information. Now, unfortunately, we're finding in some of our elderly populations that only half of them own smartphones, and so it may not be the most useful research tool. But as we know that inactivity and social capital, which is a measure of the resources available due to your geographical and social connections, are really strong indicators of healthcare outcome. I think that these data, the STEP, GPS, and social data we can extract from patients' phones, will be really strong predictors of healthcare outcomes. So what's the future plan for using this methodology in renal patients? Well, if we used this to collect data in all dialysis patients, we could look at what the difference is between different modes of dialysis. Measuring some background data in patients with chronic renal failure, we could potentially predict how someone's lifestyle will change when they go on to dialysis. Also, we could use the app to send push notifications to patients to collect patient experience data to drive quality improvement. But before we do that, we need to conduct a prevalence study to just find out how many patients own a smartphone, how they use their phones, and how they are able to use their phones, i.e., are they able to install an app, or could they get help to install an app? So next week, between the 30th of September and the 6th of October, we're going to ask 4 questions to all Central and Northern Adelaide Renal and Transplant Service patients. We're going to ask them if they own a smartphone, and if they do, we're going to ask them if they carry their phone with them 75% of the time when they leave the house. We're going to ask them if they could install an app on their phone without help, and we're going to ask them if they could get somebody to help them install an app. So what do we need you to do? There will be data collection forms available on all units. The data collection form has a script that we'd like you to use to introduce yourself and the idea of the survey to the patient. We'd ask that you report the initials of the patient here, whether they're male or female here, their age, and their mode of dialysis. Then we'd ask that you ask them if they own a smartphone, and report yes or no here. If they report no, you don't need to ask the further questions. But if they report yes, ask them if they carry their phone with them more than 75% of the time they leave the house, and report yes or no here, and ask them if they can install an app on their phone without help, and report yes or no here. If they say no to that question, then ask them if they could get someone to help them install the app if they needed to, and report a yes or no here. Although we don't anticipate there being any problems, we have thought of a couple of situations that we should clarify. If they share their phone, they do not have access to their own phone, and so answer no to question 1. If they're not sure about the smartphone status, we're defining a smartphone as one that can access the internet. If they turn their phone off until they need it, then the phone would not be able to access or collect step and GPS data, and so you'd answer no to question 2. If they could install an app, but they'd say they'd get their partner to do it, then that would be no to question 3 and yes to question 4. If they say they could get someone to do it, but they live far away, for example, their son lives in Sydney, if the son visited at least weekly, then yes, it would be feasible for the son to install the app. But if not, it would be a no, as it has to be someone who's immediately available. The idea is that if we wrote to them and asked them to install our app, that they'd be able to do it, and that the app would collect step and GPS data. So in summary, we're hoping to improve outcome and experience reporting in renal patients using smartphone technology. However, we do need to establish smartphone usage patterns first. So please ask all patients the 4 questions next week. If you have any questions, ask your team leader, and if not, please feel free to call, text or email me at any time. I've got a 4-month-old baby, and so I'm actually awake more often than you think. My email address and phone number are below. Thank you in advance for your assistance with this project.